contribution to Gavi.
This joint webinar by the Africa Center for Disease Control and the United States Agency for International Development is one of the platforms where challenges relating to access to COVID-19 vaccines and vaccination exercise in the continent is appraised. The Director General of the Africa Center for Disease Control notes with concern the recent surge in the number of cases in the continent, as he warns about a third wave in 15 African countries.
We might actually be sitting on a volcano here to erupt if we do not do the right things and do them quickly. Several countries, as we speak, about 15 of them are racing towards the third wave, and a couple of them actually are moving into the fourth wave.
COVID-19 vaccination in Africa is very low, as the continent has only administered 32 million doses of COVID-19 vaccines, which accounts for less than 1% of the 2.1 billion doses already administered globally. The lack of access to vaccines is one challenge that the U.S. government says must be addressed urgently.
We'll work with COVAX in distributing these vaccines, and we will obviously consult with partners in Africa and with Dr. Nkixon and his team on our vaccine work on the continent. We are also actively consulting with the Africa CDC and the AU on the distribution of 80 million vaccine doses that we previously announced.
Making vaccines available for poorer countries is one thing, but accepting these life-saving preparations is another ball game. The WHO at a news conference in Abuja calls for the need to address COVID-19 vaccine hesitancy.
Attitudes toward vaccination are affected by popular misunderstandings of the virus, and suspicion of COVID-19 more broadly affect perception of vaccines. Vaccine confidence must be addressed.
Only about 12 million people in Africa have been fully inoculated against COVID-19, as the number of cases on the continent surpasses 5 million.